So, with that, I'm going to actually pass it over to Anne, who's going to talk a little bit about the Protecting Patients Act and some of the work that's been ongoing over the last little while. There you go.
Thanks, Nancy. So I know that as a pharmacist, we often feel that we are the most over-regulated or legislated health profession. I've been at lectures, for example, in universities and colleges where we talk about the legislative structure of the practice of pharmacy, and we talk about federal legislation and provincial legislation and all the regulations and the pieces that govern us, the place and the person and what that's like to practice under. And so here I am with great news tonight. There's another piece of legislation that has just received royal assent actually at the end of May in Ontario to govern the practice of pharmacy in Ontario. But I did want to give you a little bit of the history, a little bit of the background of this piece of legislation tonight so that you'll be familiar with it and that you'll know to stay current with some of the events that are going to be occurring over the next, certainly the next year, but over the next few months, and remind you to stay up to date with the college because a lot of these things are going to be affecting all of us, whether it's work that the college does or the really important work, as Nancy has described, the work that you do for patients every day. So the stimulus for the Protecting Patients Act, which we in the business have sort of called Bill 87 for quite a while until it actually became an act, the stimulus was the recognition by the government that there is sexual abuse of patients by health professionals. It's not isolated to our profession. It's certainly not isolated to our jurisdiction. It's recognized around the world and in other places. And as it has been recognized, there are different steps that have been taken to prevent it and to make sure that there is a zero tolerance, and that there are steps that are being taken either by the college or by practitioners to make sure that it is prevented. So a couple of years ago, what happened in Ontario was that the health minister, and in response to some, I would say, some fairly high visible cases that had occurred in Ontario, asked all of the colleges, all 26 health colleges in Ontario, to report back to the minister on the cases that we had, the historical cases and the cases that we all had in existence that were an occurrence of sexual abuse or harassment of a patient by a health professional, to report back on how we were handling those cases, what the disposition of those cases had been and was, and what steps we were taking as colleges to make sure that our practitioners, our registrants, understood the zero tolerance and what was expected. So I will say it was quite a learning experience for us as an organization and for all the colleges to put together all of this information and structure it in a way that permitted us to have a look at how consistently we did or did not view this kind of behavior and communicate it to the membership or to our registrants. So all of the colleges submitted the information, and the minister had a task force who was going to receive it and was going to produce a report that was made available to the minister and then was made available publicly. So you may remember seeing that report last year, the report of the task force on sexual abuse of patients. So after the report was issued, the health minister constructed the bill, which was Bill 87, and as I say, which has now become the Protecting Patients Act 2017, and which received royal assent just at the end of May. So the intent of this legislation, and I'm sure that I don't have to tell you that this issue of sexual abuse of patients was coming to the forefront at a time, and we only have to look even to very recent events, at a time when there is a real societal recognition of sexual abuse and sexual harassment in general, not just the egregiousness of sexual abuse or harassment by a health professional to a patient. So you got to recognize that there are some societal things going on, and certainly a decreasing tolerance for any kind of behavior of that sort. And at the same time, I would say that there has been a spillover of distrust of regulatory organizations. I could say some distrust in society of government, for example, of colleges as an offshoot or as an arm of government, in how we have been, as Nancy says, doing our job at protecting the public. So this sense of uneasiness or distrust of what the colleges do, what the business of the colleges is, and whether we have been transparent and whether we have been clear, and whether we have actually protected patients or assisted you in protecting patients from harm, not just doing good for patients, but protecting them from harm as well. So in this atmosphere of increasing distrust that was directed at healthcare professionals, but also at the colleges, sometimes for our handling of these cases, along came this bill. And so that's to help you understand a bit of the sea change that has been occurring in the province, in the country, and around the world on this particular topic. So as we were looking as a college at our processes and how we could become more transparent about what we do so that the public would understand what we do, what you do, and to increase the trust in the public, the trust that your patients have in you and in the college as the regulator of the profession, this bill would have certain intentions. So one of them is to make sure that we are strengthening the zero tolerance policy on sexual abuse of a patient by all health professionals in Ontario. And at the same time, we are promoting and making sure that we have greater transparency of the processes that the college goes through in regulating our members, our registrants, and public involvement in our committees and in the decision-making processes and the adjudication of matters at the college. So the more that we can get the public involved and get the public interested in the things that we do, presumably they will have an effect on our processes, they will understand some of the decisions that colleges and committees make, and there will be a greater trust in this system of self-regulation that is in place in Ontario. So greater transparency means greater transparency about us as a college, about the things that we do, and I'm sure you've recognized over the last couple of years, it means greater transparency about you. So it's greater transparency, more pieces of information that are available about you to the patients who are making the choice to come to see you and to get care from you. And I know that feels kind of uncomfortable sometimes. So if there is more information about you or about me on the public register, which is the mechanism by which the public can find out information about all the health professions in Ontario, if it feels a bit uncomfortable, I would suggest that you turn it around a bit and think about what you would want to know about a health professional that you were either choosing to go to or you were suggesting that someone in your family go to. So if you were sending a member of your family who was in distress or needed medical care, if you were sending someone to a health professional, what might you want to know about that person? Might you want to know something about their history or their background, or whether they had had complaints against them, or whether there was some remediation or some outcomes that they had been required to do? And generally, when we ask the public, the answer to that is yes, they would like to know more. So I think, as Nancy said, we have to turn it around and think about the patient as we are patients sometimes, or as our family are patients sometimes. So this omnibus bill is intended to increase transparency, to increase the trust in you as a practitioner and in the colleges in this area of both sexual abuse and in governance, in the way that we govern ourselves. So there are a couple of buckets, a couple of big changes. This bill had 6 parts to it, and the biggest part, the most significant part that I'm going to mention to you tonight is changes to the Regulated Health Professions Act. So when we think back to our jurisprudence of the RHPA, and maybe there are some people in the room like me who, when we graduated, there wasn't even an RHPA, there was a Health Disciplines Act, and so there have been changes over time. But the Regulated Health Professions Act is the umbrella act under which all of the professional colleges are governed. So for example, there's a Pharmacy Act, and there's a Medicine Act, there's a Nursing Act. So the RHPA has the most significant changes through this act, and the ones that are most significant for you and us in the room. And the biggest changes that have occurred in the RHPA since it was introduced some time ago. So those changes specifically, as I've said, are going to mean more information, even more information than has happened over the last couple of years on the public register about practitioners. Now, we as a college have already made most of the changes in advance of this legislation, so there aren't a lot of changes for us. What you see on the public register now is pretty much the way it's going to stay for us. Some additional roles and functions of the Patient Relations Committee. So this is a committee that it's a statutory or a required committee, and it concerns itself with the prevention and the communication of steps to prevent sexual abuse of patients. Also, some changes coming to the composition of our college as a council, as Nancy has described, potentially about the election of how we compose the council or the board, which governs the practice, and about committees. So specifically about those committees, the composition of those committees that adjudicate or that make decisions about complaints and about registration matters, for example, that come to the college about our registrants. So that's something that the public has been looking for. Potentially more involvement by them and less involvement by the professional members of the profession in the governance. And then additional practices, so maybe some changes that we're still waiting to see what they will look like, related to the investigation that the college performs when there are allegations of sexual abuse. So there is going to be another report by the end of the year, and it will look at all of the best practices of all the colleges and make recommendations as to what some of those changes might need to be in the way that we investigate these allegations. So just wanted to summarize, and I know you won't be able to see this and it's a little bit bright up here, but just to give you an impression of some of the things that are in place now. It's kind of a busy slide, but to let you know that because this was a pretty significant piece of legislation, there are some pieces of it that are in effect now. So back to your jurisprudence, the bill received royal assent at the end of May, but there are parts of it that have not been proclaimed into law yet. And that's because some of the pieces still require some regulation drafting and some regulation consultation. So that's going to occur over probably the next 6 months or so. But specifically in effect, the complaints committee, the ICRC, has the authority to make what we call an interim order to suspend the certificate of registration of a member as soon as we get a complaint, if the committee feels that there is a clear and present danger to the public or danger to patients. So that's a pretty big change. Now, if that happens, if an interim order occurs, the college would need to expedite the investigation, because obviously it's a matter of clear public interest. So we would expedite the investigation and bring the matter very quickly to adjudication. But we can do that now prior to a referral to the discipline committee, and that's a new authority. There's also a minimum 1-year period of prohibition now of a sexual relationship with a former patient. So that means that for 1 year, once the clinical relationship has ended, there cannot be a sexual, personal relationship, intimate relationship with that patient. And I don't know if what's going through your mind is possibly, when would you know when a clinical relationship had ended? It's probably easy to know when it starts. Someone brings you a prescription, or someone asks you for some advice, or you have some documented care. But when does it end? Does it end the last time you fill a prescription, the last time you see somebody or talk to somebody? And how do you know that that's going to be the last time? Nevertheless, this is in the bill. The piece that is still to come into effect, so the part that I have on the right there, not yet in force, are some definitions of exactly what constitutes a patient or a clinical relationship, such that there would be a prohibition of something personal within that year. So all the colleges are working on this. There will be some draft regulation introduced soon, because one of the things that is really important when we look at a piece of legislation like this is that there be consistency across the colleges. It wouldn't make sense when you think of the circle of care and you think of a team of health professionals, it certainly wouldn't make sense if there were different criteria for one profession than for another. So it is going to be 1 year for everyone, but that start and finish is going to need to be figured out so that there's consistency among all the health professions. As I said, some increased roles and functions of the Patient Relations Committee, and importantly, there are increased fines for failing to make a mandatory report. And this is really important because if you think of some of the things that have happened, I will say around the world recently, where there had been allegations of sexual abuse that had been known by a lot of people in a particular industry and had never been recognized or had never been brought forward, I'm sure you all look at that and have had the reaction that that's not right, that how could that have occurred? How could people have been silent for so long? So this is the same thing. There are increased fines in this piece of legislation for failing to make a mandatory report about sexual abuse. So it's really important that we stand up. We are not only the protectors of our own personal patients, but we are protectors in general of the patients that come to our practice. And so anything that we are aware of requires a mandatory report. So that has always been there, but there are increased fines introduced in this legislation. And also on the right, a few more reporting pieces of information that we will be putting on the public register, and that will require us to ask you potentially for some new information next year when you... Thanks for letting me know that there wasn't something on the right. So things that are currently in effect and things that are not yet enforced was the main thrust here. So the lesson is stay tuned, and we hope that you're always paying attention to eConnect, and you're always paying attention to Pharmacy Connection, and you're always looking for new information from the college, and these are the ways that you'll find out about some of the new things. Just wanted to mention also that we have, of course, governance of the place in Ontario, so not just the person but the place, and that's through the Drug and Pharmacies Regulation Act. So also in Bill 87, there was an adjustment to the fact that we can also order an interim suspension of a certificate of accreditation. So the same authority that I just described over a member, that the college could issue an order pertaining to a member, we can now also do it pertaining to the certificate of accreditation. In other words, how a pharmacy is able to stay open if there was that we had knowledge that there was clear and present danger to the public. So we would be able to issue an interim order. And interim orders can be varied. They can be adjusted if there is demonstration that the public will be protected and that something has occurred that would give us cause to change that. So implications for professionals, just finally to remind you, sexual abuse is something that attracts serious consequences for all of us, including the part about not reporting if you know. More information on the public register about all health professionals, responding to a societal expectation that patients and the public want to know more about their healthcare providers. Lots more patient and public involvement in your regulation, in the regulation of the profession, and interest in the processes of the college and the ways by which we actually regulate. And just that sense of an evolution of self-regulation. So we've grown up knowing that we have this system in Ontario, and as Nancy mentioned, it is under some criticism around the world, and there may be some changes to come. The international view is that it's not necessarily the best model for protecting the public, so there is some evolution probably coming, and you'll want to stay tuned for that.